Hello, everyone. My name is Catrell Ellis, and I'm Associate Counseling Psychologist at the Wellness Center. First of all, I just want to say Happy World Mental Health Day. Big up to all the people out there who are in this field, working alongside people who are having challenges and struggle with mental health, and individuals out there who are doing their very best to bring awareness and breaking the stigma. Today, we'll be talking about mood disorders, bipolar, and depression from a male's perspective. Hope you guys enjoy. As I said, we'll be looking at bipolar disorder and depression from a male perspective. But first, I just want to look at some myths, and then we're going to talk about the different types of mood disorders, and we look at depression, what it is and what it looks like in men, bipolar disorder is what it is and what it looks like in men, and just talk about bipolar disorder 1 and 2, and then we'll go in to discuss the treatment. One of the things when it comes to talking about mental health, there's a lot of myth and stigma behind it. But when we look at men's mental health and the myth that comes along with that and the stigma, this is a whole different world and ball game, because men's mental health is not talked about as much as it should, and I am a big advocate of it. And I think nowadays it's getting more and more and more look into, but I think there's more work that should be done about it. And so I just wanted to look at some myths with depression and bipolar disorder. A lot of them may come across or just cross over with, just general mental health. And you will see many that you'd be like, oh, that could be for depression, or oh, that could be for bipolar as well. Now, first off, we have myths about depression. And the first thing we have is depression is a sign of weakness. Depression is not a sign of weakness. Individuals who struggle with depression are less likely to speak about it. They're less likely to share how they feel, to share their thoughts. They're less likely to trust others. Individuals who are struggling with depression are less likely to engage in activities or socialize like how they used to before, due to a lack of interest and lack of pleasure, so they become more reserved and isolated. However, speaking about depression will help with that. Imagine you have a cup of water and you just keep pouring water into that. Eventually, it starts to overflows, right? Similarly, if you keep in a lot of thoughts and feelings, it eventually overflows and may not know how to cope with it properly. However, speaking to someone you trust or know can help with that. Because you're feeling sad, you are depressed. No. Being sad is an emotion and we all experience it. However, if the sadness is persistent over a period of 2 weeks, as we will discuss further down the line, then we can be like, maybe he's meeting the criteria for depression. At the same time, we'll assess and see other areas as well. Depression only impacts women. That's not true. It also impacts men. However, women are more likely to talk about their feelings or having thoughts of depression as opposed to men. You went to university, so how are you depressed? Yes, this was said to me, not directly. Someone told me a story about this, and I was like, oh, wait. So a lot of individuals out there are still not educated about mental health and what it is and how it come about, right? You should be able to control your emotions. Men should be able to control their emotions. A lot of men do not know how to control their emotions, and especially when it comes to depression, as we will see in further slides, that men display depression differently from women on some aspects. Now we're looking at myth about bipolar. Now the first one is mood swing is an indication of bipolar disorder. Not necessarily. Mood swing doesn't equate to bipolar disorder. No. Manic episodes are fun. Manic episodes are not fun, because as you will see further down the line again, they will come with a lot of irritability, being on a high, seeking pain for pleasure. So being or experiencing a manic episode is not fun. There's only one type of bipolar disorder. When it comes to bipolar disorder, one of the things we hear in the media is just bipolar disorder, and it doesn't go in depth to discussing about bipolar 1 or 2. And we will talk about that further. Children cannot be diagnosed with bipolar disorders. Yes, they can. Men are naturally aggressive. Now, with that being said, because men are naturally aggressive, we tend to overlook whether they might be struggling or having challenges with maybe some mental health issues, for example, bipolar disorder or depression. So I think this is something that we need to look into further with men, and as opposed to just taking it for what it is, and really look more in depth and gain more understanding of how mental health can impact men. Now we're looking at types of mood disorders. Now, I don't want to go too in depth with mood disorders, but depression and bipolar are mood disorders, as it has a lot to do with mood, changing functionality in your mood and how mood impacts your daily living. As you can see here, depression is one of the major mood disorders, and within that major mood disorder, you have a subtype of depression. So disruptive mood dysregulation disorder. And also for bipolar, you have another one here. And similar, you have bipolar 1 and 2. You also have substance-induced mood disorders and mood disorders due to medical condition. Now, all these mood disorders alters, your daily functioning and how you feel, how you think on a daily basis, particularly when it's persistent. It can impact you on a severe level, which impairs you from functioning how you would normally function, going to school, work, socialization, blending family, as we will see further down the line as we get into the slides. Now we're going to talk about depression. Now, I don't want to go too in depth with depression. However, I'll just go over the basic or like a brief overview of depression and what it entails and what it looks like in men and how it impacts men. And what are some signs or behavior that you may see that we may overlook and just think it's a normal male behavior, but depression could also play a role. Now, what does major depression disorder look like, or MDD? As I said earlier, it's a persistent feeling of sadness. That persistent feeling of sadness, hopelessness, emptiness, and irritable mood. That reduction in interest or pleasure in most, if not all, activities that the individual partake in. Now, for example, for men, they might love going to the gym, might find pleasure in playing sports, track and field, football, right? But what happens when you're struggling or having challenges with depression? You realize that you find less and less pleasure in doing these things. You probably find less pleasure in playing games, right? You probably just be like, oh, don't want to do this no more. I don't have any feelings to do it. Now, you also have insomnia, which is, a sleep disturbance where you're struggling to sleep. And then you have hypersomnia, right? Where you just sleep for long, lengthy periods of time. You also have weight loss, lack of energy. You do see a lot of lack of concentration or lack of focus, where the depression is just so much that you're unable to focus. Poor hygiene, we see a lot of that as well, where the self-care reduces. So maybe taking showers or anything like that doesn't happen as often. And as you can see here, it should be noted that symptoms must be present for a period of 2 weeks and at least meet 5 or more of the criteria presented for the symptoms to be diagnosed as MDD. Now, what does MDD look like in men? After doing some research, it suggested that men living with depression are more likely to react by engaging in risky behaviors, use of substance. This is starting to sound a little bit familiar, right? Engaging in gambling, becoming workaholics, or behaviors are displayed through anger, right? And now, just reading about that, what do you think? Thinking back about maybe some individuals you may see engaging in risky behaviors, using substances, reacting in a angry manner. Uh, what do you think? Would you say it may be some signs of depression there, or was it situational? What was the evaluation of that time period, if you can reflect on that, right? Now, individuals who scored high on irritability are more prone to impulsive behaviors, uh, lack of control of their emotion, aggression features similar to panic attack, and also minor annoyances that stirs up anger, stirs up these unwanted feelings or feelings that they're unsure about. So minor things, it could be maybe something fell on the floor and they just overreact and all these emotions are just poured out. So you will see this or certain signs in men who are struggling or having challenges with depression. Now, what does it look like in men continue? So we have behavioral and emotional. So avoiding family and social groups or social gatherings, difficulty with work and family responsibilities. So maybe challenges come about where they're just having difficulty balancing with work, family responsibility, that lack of motivation that you would usually feel when you're going to work or having that drive with the family probably is not there due to those depressive feelings or depressive thoughts. So probably there's no motivation there. Abusive behaviors in relationships, controlling abusive suicide attempts. As we know, men are more likely to follow through with suicide attempts as opposed to women. And we will see more consumption of drugs, drinking. On an emotional level, you see anger, sadness, and irritation. These are the most emotions that you will see men express, display, show when it comes to the symptoms of depression. I can also say aggression as well. You can put that alongside anger. Um, Bipolar disorder is next. Now we're about to talk about bipolar. Man, I really like talking about this topic. Um, but I think it's important for us to differentiate between bipolar 1 and bipolar 2 and how it can have an impact on men, what signs or what symptoms we may see. We may see things that are similar to depression and some other interesting information. Here we have bipolar 1 disorder. Now, this disorder consists of manic, hypomanic, and depression, right? So, this is where you see individual will express symptoms of inflated self-esteem, reduction in sleep, talking loquaciously, easily distracted. You will see individual engage in activities that would involve high potential for pain. So maybe individuals won't feel pain, so they go get a tattoo. And I'm pretty sure tattoos are very painful, right? So you will see individuals want to engage themselves in order to feel a high pain threshold. Purposeful goal directed activity or non goal directed activity. You will see a lot of individuals with psychomotor agitation and their thoughts are on autopilot. Now, one of the things is with this autopilot thought processing is that it causes difficulty in sleeping for a lot of individuals who are struggling with bipolar disorder, similar to depression, where the thoughts are just running, 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 running. And so that also goes into the aspect of sleep disturbance, which is a whole other category by itself, but we won't get into that today. For bipolar 1, symptoms are present or must be present, has to be present for at least a week and meet at least 3 or more of the criteria in order for an individual to be diagnosed with bipolar disorder 1 onto disorder 2. Now we're looking at bipolar disorder 2, which consists of hypomanic and depression. Now it's important to know that all symptoms are exactly the same. There's no difference or differentiation in symptoms with bipolar 1 and bipolar 2. They're both the same. However, the severity level or the severity scale is huge. With bipolar 1, the scale is more severe. It tend to impact individuals' daily lives, so their family, their own, their social work life. It impacts and it causes an impairment to the point that some individuals has to be admitted to the hospital. Whilst hypomanic now is less severe, right? And individuals can go about functioning on a daily basis, right? Whilst bipolar 1 disorder, the disorder has to be at least a consistent for a week. Bipolar 2 disorder, it has to be 4 consecutive days. Another differentiation is that for hypomanic, there must not be any past or any history of any manic episodes, which is a part of bipolar 1. Any history of manic episodes or anything of the such, then it will be considered bipolar 1. Now, what does bipolar disorder look like in men, right? As you can see here, I have that research suggests that early onsets of bipolar disorder are more common in men as opposed to women. And as you can see, whilst 18 to 29 is the most occurrence, you can see that percentages indicate that it begins to fall in men in their early 30s. Other studies also spoke about how lower rates of appetite in men are more prominent compared to women. You know, episodes of manic are more manifested through aggression, impulsivity, and violence. Similar to what we spoke about earlier in terms of how men express are more likely to show their emotions or issues in a different manner with the disorders compared to women. Um, Men are more or less likely prone to the depressive episodes of bipolar disorder. And I find that to be actually interesting. Won't go too in depth in that, but I just found it interesting enough to put there. Here we will look at treatment and the different types of treatment that we have for both depression and bipolar disorder. Now, a lot of the treatments that are presented here do work for both, and we will see what they are. As I said, I won't go too in depth with them. I'll just give a brief overview of some of them. What does treatment look like? Now, over the past few decades, we've seen an enormous increase in medication formulation, creation of these medications to help individuals with all types of disorders. We've seen psychiatrists prescribing individuals with various type of medication to help improve individuals' moods, especially with depressive and bipolar disorders. We're seeing mood stabilizers, antidepressants, and antipsychotics because both bipolar and depressive symptoms can be accompanied with psychotic features, but that's a whole different topic. We also see that these medications help to bring balance on the neurological aspect. That's a whole nother topic on its own. So medications are also out there as treatment to help individuals bring balance to their moods. We have cognitive behavioral therapy, and a part of that is my very favorite, monitoring, self-monitoring, mood monitoring. You know, whether it's rating yourself on a scale of 1 to 10, how am I feeling today? How are my moods? With 10 being extremely moody or extremely high, and 1 being no mood at all or not feeling moody at all. Where would I rate myself? It helps to bring that self-awareness, that presence, bring you and allow you to know what is happening with yourself, right? You also have cognitive restructuring, where it helps with the distorted thinking, the distorted thoughts that may come about with the negative thoughts. You also have enhancing social skills. So there's various homework provided to help individuals develop their skills, problem solving skills outside of the therapeutic room and into the so treatment continuation. Here we have dialectical behavioral therapy, and this is well known in the therapy world, known as DBT. So first off, we have interpersonal skills, where individuals develop skills similar to what we saw in CBT as enhancing social skills. You're developing your own skills, your personal skills to help you out with, socializing, you know, working alongside family members, friends, just help you with your interpersonal skills, help you with skills for yourself to develop and help you to regulate your moods, emotional regulation. So this focus on identifying your triggers, identifying your moods, identify what emotions you experience the most, right? What triggers those moods the most and help you to cope with that and develop skills that when these moods come up, you're able to handle them better. Distress tolerance, how to manage yourself under stress, how to build a stronger or a more enhanced, improved tolerance to stress. How can you cope with this? How can you improve yourself when you're under stress? So the stress tolerance shows that. It shows what you can control, what you can't control, and how you go about that. Mindfulness is very, very important and very critical. It's very useful in the world of therapy. It helps individuals become present, help them identify and help them realize their moods, help them realize when they're becoming extremely moody or they're becoming dysregulated in terms of their emotions. Mindfulness helps you to be present. It helps you to be aware. We have the interpersonal and social rhythm therapy. Now, it looks at personal issues. When did they start? When did the mood start? How does it impact you on a daily basis? What was your previous experience? What were your previous coping skills? And this is where the social rhythm therapy comes in because it helps you to develop with effective routine, which we see used a lot with bipolar disorders or individuals who are struggling with bipolar disorders. It helps to regulate the circadian rhythm, focus a lot on sleep. It helps to set the person in an appropriate time to go to bed and have a good sleep cycle. It also looks at developing activities, routines that help benefit the person to put them on a positive trajectory and just put them in a better place. You know, and so these therapeutic approaches that are presented, there's a whole lot behind them. So if you want more information, you can go into them. But I hope what I shared about these treatment was informative. Now, I just want to say thank you all for watching this presentation. I hope it was very informative and interesting to you all. If you want further information or if you know anyone who may need therapy or you may want to seek therapy yourself, you can always just scan the code right there and it will lead you to the Wellness Center and our page. My name is Cottrell Ellis and it was a pleasure to bring this to you. Happy World Mental Health Day. Hope you continue to bring that awareness. Hope you continue to bring more stigmas. And if you haven't done it yet, go out and do it. Never too late. We need as much help as we need. Big up yourself and enjoy. Thanks.